on Health, sponsored by LongRock Clinic.
Welcome back, folks. Well, yes, indeed, it is our Eye on Health segment. I'm joined today by Kim from LongRock Clinic. Of course, today for a lot of folks, it is a holiday of sorts, 420, of course, celebrating marijuana and all of its different forms. But for a lot of folks out there, whether it's off the books or not, they may be using cannabis products in an effort to treat mental health issues. But I know that sometimes may not come with the results that are expected. Tell me about that.
Absolutely. So cannabis can be used therapeutically, but it really depends on the setting, the intention, and using a professional guide. Being in the right intention, being in the right setting is important. Cannabis can actually help us feel our emotions in our body, can do some somatic processing, but it definitely can absolutely be therapeutic in the right way.
Yeah, that is an important element right there that you mentioned, the intentionality of it, and having that sort of extra guide as well that can make such a big difference. And I know LongRock Clinic, you offer different options, not dealing with cannabis, but rather with ketamine, and sometimes those two may not play well.
You're absolutely right. So at LongRock Clinic, we offer ketamine treatment for mental health. And you're right, we shouldn't be mixing substances.
Yep.
Both are great used therapeutically with intention, responsibly, with a good setting and guide. But ketamine can actually be a really good way to treat depression, especially treatment-resistant depression or depression that hasn't really responded to other therapies, both psychotherapies and regular talk therapy and all different kinds of traditional antipsychotics and depressants.
Certainly, and you're a social worker with LongRock Clinic. So tell me about that sort of guiding process that you offer.
Yeah, absolutely. So I'm a licensed clinical social worker with LongRock, and I provide ketamine-assisted psychotherapy, which engages clients in talking about their experiences using ketamine, using what they've learned while they're under the medicine to integrate what they're learning, the insights that they're making, and also make positive changes in their daily life. So it's kind of therapy with the added plus.
And another element of this, the idea of treatment-resistant depression. Tell me about that. What exactly is that? How do you diagnose that as an issue moving forward?
Yeah, so typically when people are treated for depression, they might try talk therapy, working with therapists, different kinds of therapies, maybe even antidepressants. So treatment-resistant depression happens when none of those things have really worked to provide relief. So maybe people have tried several different kinds of antidepressants and haven't really found the relief. So ketamine could be a possible way to fit that in, to kind of get some relief and really make some positive changes with the help of a therapist.
And everyone is a little bit different. What the treatment might look like or what the treatment that works best could be different, but that's really where you come in, trying to diagnose that as the licensed clinical social worker there, right?
Absolutely. So I can definitely diagnose treatment-resistant depression and also find out maybe what treatment modality, what therapy, what kind of talk therapy can work best for the particular client. And of course, using ketamine. Ketamine is a great way to boost normal therapeutic qualities and things that we talk about in therapy due to neuroplasticity, which is a fundamental part of ketamine.
And it's all about getting the best outcome for everybody.
Absolutely. That's what we try to do.
That's what I like to hear. Well, thank you so much, Kim. And there you go. Maybe that's something that you might want to look into here on this holiday of 420. Brianna?